Hello my dear friends, today we will be discussing an important topic in pediatric dentistry in pulp therapy, that is pulpotomy. What is pulpotomy? What are the various types of pulpotomy and what are the materials used will be discussed in this session. So what is pulpotomy? Pulpotomy is a surgical removal of the coronal pulp of a recently exposed tooth in order to relieve pain in a patient who is having severe pain and to maintain the vitality of the radicular pulp, that is the root pulp, thereby maintaining the tooth in the dental arch. Okay, there are various indications for pulpotomy, that is vital pulp exposure as a history of mechanical or traumatic injury that is leading to the inflammation in the coronal pulp, caries exposure with 1 or 2 millimeter without spontaneous pain, and in a young permanent tooth there is a pulp exposure and the tooth is not formed completely. There are a lot of contraindications for pulpotomy like spontaneous pain, tenderness on percussion, there's more than 1/3 of the root resorption, you have a big carious lesion, there's a lot of bleeding from the canal orifice, medical contraindication that the patient has heart disease or is immunocompromised, there's swelling, there's internal external resorption, and there is mobility of the tooth. So how do we do a pulpotomy procedure? Initially anesthetize the tooth, apply the rubber dam, remove all the caries with the high fissure burr without entering the pulp. Remove the dentinal roof with a large diamond burr with very less trauma to the patient. Then with a spoon excavator, remove the coronal pulp. Clean the pulp chamber with saline. Place a small cotton pellet on the coronal pulp chamber to arrest the bleeding. So then once the bleeding is arrested, a small cotton pellet diluted with formocresol should be placed on the pulp for 4 minutes and isolate the area with the dry cotton to avoid formocresol to contact the tissue. Once the cotton is removed, you should see brownish discoloration of the pulp, which means there is fixation of the pulp. Then place zinc oxide eugenol cement in the pulp chamber. Then recall the patient after 1 week. If the patient has no pain and asymptomatic, then you can place a stainless steel crown as shown in the picture. So what I've explained, remove the caries, remove the coronal pulp, fix the pulp with the formocresol solution, then place the zinc oxide eugenol cement, recall the patient after 1 week, and then place the crown if the patient doesn't have any pain. Types of pulpotomy. There are 2 types, vital pulpotomy and non-vital pulpotomy. In the vital pulpotomy, there are 3 types, that is devitalization, preservation and regeneration, which we'll be discussing one by one. Now, what is devitalization pulpotomy? Devitalization will tend to mummify the pulp. There are 2 types. One is a single sitting done in 1 appointment and there is a 2 stage, which means it is done in 2 appointments. In the single sittings, the materials that are used is formocresol, electrosurgery and laser, and in the 2 stage there is Guy's trio paste, Essex paste or paraform devitalizing paste will be used. You can see the materials on the screen, that's formocresol, Guy's trio paste, devitalizing paste. Now in the vital pulpotomy, there is a second type, that is a preservation pulpotomy. It will try to preserve as much as vital tissue is present but it will not form something called as a reparative dentin. So the materials that are used is zinc oxide eugenol, glutaraldehyde and ferric sulfate. So since it is not forming the reparative dentin, we will go and see the third type of vital pulpotomy procedure, that is the regeneration procedure, which leads to the formation of something called as a dentinal bridge. The various materials that are used in regeneration vital pulpotomy are calcium hydroxide paste, BMP, that's bone morphogenic protein, mineral trioxide aggregate, enriched collagen, freeze dried bone and osteogenic protein. So you can see the various materials that are used in regeneration vital pulpotomy, MTA, calcium hydroxide, BMP and so on. There's another type of pulpotomy called as non-vital pulpotomy, but it is rarely used in very compromised cases. Beechwood cresol or formocresol is used. So in this session we have studied about pulpotomy, the various types of pulpotomy, the materials used in pulpotomy. In the pulpotomy you have vital pulpotomy and the non-vital pulpotomy. In the vital pulpotomy you have again three types of vital pulpotomy and the non-vital pulpotomy, which is done in compromised cases and which is rarely used. So I hope I was able to make you understand about pulpotomy procedures. If you have any questions, please tell in the comment below. Please like, share and subscribe my channel, and if you want me to discuss other topics in pediatric dentistry, please write in the comment below. Thank you so much.